Okay, so these are the exercises that you can start off doing. So you can lie on your back. If you have somewhere to lie on, you can try it out. So you can lie on your back, and you can try hugging both knees up, and you can hold for 3 seconds and release. Hold for 3 seconds and release. And you can do that for 5 times. This is good to get the lumbar, the lower back moving. And if you can also add in a variation of a gentle side-to-side rock. Depending on your mobility and your flexibility, on the degree of side-to-side angles that you can rock your lower back. So if you feel any spasm coming on or any discomfort, then you need to actually slow it down and not go too far. So this one is a single leg stretch, rotational stretch. You can aim for the opposite shoulder, and you can hold it there for 3 to 5 counts. So you are looking for a gentle stretch in the glutes, in your lower back. Yeah, so you can repeat that 3 to 4 times to 5 times, depending on how you feel as well. So the other one, if there's no pain, no discomfort, you can aim to rotate further. This, you need to aim for your opposite, for your same side shoulder to remain in contact with the ground. So you can see how far I can rotate. So that's about maybe quite stiff, 45 degrees. That kind of torsion, you need to be wary of. Some people might find it a bit too discomforting. Then you just stop where you can. So everyone has different flexibility. So you can see here in Alicia, she can almost get her knee down to the floor. Yeah. So for this, if you can even get the stretch all the way to the thoracic spine, your mid back, and that is a very good rotational stretch as well. So especially when you come back and bring your leg down to the floor, do it at a slow, moderate pace and not just slam your leg onto the floor. And remember to breathe. Yeah, it's very important. Take a deep breath in, breathe out, and rest. Okay, so we're going to do a bit of exercise. So the first exercise is your sit to stand. So for me, I'm on the red stool, and this, you can see that my knees are moving forwards. This will cause a lot of pressure in the knee. So that is not what you want to do. You want to keep your knee behind your toes, and you can even lean slightly forwards as well, just to make sure that you do not slouch. So keep your back straight, lean forwards, and stand. If you feel that there are any pressure in your front thigh or your knees, you need to stop. Maybe change the height of a chair or get a higher chair. And next, we can go on to the squats. So squats is a progression of the sit to stand. And you can see here, Alicia goes down to the floor very easily. The advanced version is where her feet are closer together. Don't worry that if you can't squat as low as her, you can go halfway or even 1/4 way. Yeah, it is fine. But the same thing, knees behind toes and your back in neutral spine. That means flat back. Okay, so then step ups. Step ups is a very very good exercise. Like you can go and climb stairs. Same thing, I'm doing the easier version where it's a lower step. My knee is still behind my toes. I'm using my bum muscles to actually execute the movement. So the same leg. So this in this video is the left leg. I'm not bouncing up with my right. The incorrect one is to watch your knees, whether or not they are collapsing inwards. This will actually put a lot of stress in your knees, in your inner knee. And if you feel the pain, definitely stop doing it. Yeah. And lunges. So a lot of you are desk-bound workers. Lunges is a very good way to actually open up your hips and get your hip flexor stretched. So you can hold on to a chair, bring your leg back, and make sure that your back is straight. You can do this 8 to 10 times on each side, and make sure that you're not leaning too far forwards or overarching your back. The front leg, the knee should be behind your toes. So if you are steady enough, you can do it without a chair. You don't have to go down too low. This video, Alicia is just stepping back and just feeling the stretch in your hip flexor in front, the front of your hip. Yeah. Okay, this is the simplest exercise. It is about the hip tilt, but it is in lying. So what you're trying to do is to roll and peel your hip, your tailbone off the floor. I am in the video, I'm doing it the wrong way. I'm actually just lifting up using my lower back. So what you should be feeling is that gentle, nice hip tilt and lifting. So it's a very subtle bum squeeze. You shouldn't feel any pressure in your knees or your thighs. If not, you can adjust your feet in your position. Maybe you're bending too much. If you are feeling your hamstring, you can actually point your toes up and just have your heel in contact. For this exercise, if it's convenient enough to do it on the floor, you can do it on the floor. Some of the feedback is that the mattress can be too soft and you end up digging your heel into the mattress. Yeah, so then you don't really feel the actual bum squeeze lifting up. The advanced version is a single leg bridging, which Alicia is doing. You can have your knee bent or your knee straight. And you should only feel one side of the glutes working. All right. So the warm-up exercise, yeah, so you can try doing the warm-up exercise together. So find a comfortable spot on the floor and you can start doing the leg, hugging your legs. So you just hold for 3 counts and release, holding for 3 counts and release, and we do it for 5 times. And then you can, and if you are able to do the progression, then you can try doing the side-to-side rolls. So right, and then left, right, and then left. So you don't want to use momentum, you want to actually go slow. Yeah, and then the next one is your single leg diagonal stretch. So with a little bit of rotation, you might feel a little bit of a glute stretch. So right leg to your left shoulder, right knee to the left shoulder, and down, and left knee to right shoulder, hold for 3 counts, and down, and right knee to left shoulder, So, so then you can go a bit further. Make sure, remember to get the shoulder in contact with the ground, and you can pull. So if you do this at home, and if it's in the morning where you feel a bit stiffer, then you don't have to rotate too much. So right leg over to the left in 90 degrees, and left leg over to the right and hold. So if you want to progress slowly, then you can straighten your leg out or to aim your knee to the floor. Yeah, not too flexible. So you can repeat it again, or if you feel warmed up, you can aim to go lower. Just beware of the torsion in your mid back when you aim to go lower. So right knee over, aiming to touch the floor. Okay. Okay, so the exercise bit. Make sure that your knees are behind your toes. So you actually want to shift your weight into your bum as you sit. Alicia has a nice curve in her lower back, but if you don't have, it's fine. You don't have to exaggerate the lower back curve. You need to keep it as flat as you can. So this is the squat. So she's just making parallel, about 90. You can also still stay at your seat and just hover above the chair, so that there's a good cueing. Sometimes without the chair, some people might get confused, so don't worry. So the same thing, you shouldn't be rounding your lower back. So if you're able to, and your knees are comfortable, you can aim to go lower. So having a wider stance, you can squat to lower. When you come up, you need to feel that your glutes are the one that is pushing and standing you up instead of your thighs. Probably a little bit of your thigh, but not totally the thigh, so both. So then this is a narrow stance. It is much more difficult. Some people feel like maybe their tummy is getting in the way of the squat, but that's okay. You just try to where you are comfortable at. So you shouldn't feel any knee pain. Sometimes with a knee locking, it can be a different issue as well. So you need to check whether or not the muscles around the knee or your knee positioning, the kneecap positioning, whether is it okay. If you do it wrongly, you will actually add a lot of stress into the knee. So, a step up, I'm not sure whether you guys have steps at home, but if you have, like, if it's in a corridor, you can try when you have time, to see whether or not you bounce whether you use your back leg to bounce up or you're able to push to get the step up using the leg that's on the step. It's a good cardio and a good strengthening as well if you decide to start stair climbing, but you just try just one flight first. One flight and one easy step. Alicia's great step, that would be about 2 steps at once, and that would be a bit harder. So you should feel your glutes that's pushing you up. And I'm demonstrating the wrong technique. Your knee shouldn't collapse in. This would be really painful for someone who has that arthritis in their knees or any problem. So lunges. The step back should be nice and comfortable so that you will still maintain your back being straight. Alicia here is doing quite fast. You can actually pause, take your time to lower down and feel the stretch in the front of your hips. Yeah, it is a really good stretch, an exercise to do after a long day of sitting. Even just with this, some people, I've seen a couple of clients who just needed this to feel the glutes squeezing and to feel the front of the hip stretching. It should be nice and gentle. You shouldn't be feeling this in your knee. Yes, patients with osteopenia and osteoporosis can do this exercise. I think you will answer that, but it needs to be really guided. In general, exercises even like this with body weight will help you to help you gain muscle strength, and that kind of stress to the muscles will also get the bones like retaining the calcium again. Obviously, will explain better. Okay, so bridging, this is everyone's favorite. You can start off with just hip tilting, tucking your tailbone under. Your tummy should be nice and soft, and just pulling off the breath. If you are confused with the movement, you can just lie down and squeeze your hips together. So just squeeze your arm that you're holding it. And then as you get more aware of your glutes, then you can actually try and do the slow hip tilt. So it should be a nice and easy hip tilt, like a rocking movement. And then after that, you can lift up higher. You can try doing the single leg bridge, but if you feel that your hips are off center and you're dropping, for example, this one, Alicia is on her left. If you feel that you're dropping your right hip down, you're feeling the strain in your lower back, then you can go back to the double-legged bridging. So you should be feeling the right glutes. So the more challenging one, you can straighten your right leg up and lifting your bum through the left leg. And you should try to breathe, so don't hold your breath. So switching legs to the right, left leg straight.